Hello everyone, welcome back to our Lakota Health and Advocacy series. Last class we talked about just general, what is Lakota Health and Advocacy. It was an introductory course. Today we're going to be talking about COVID-19 and how we can be health advocates during a pandemic. That is our main question. We're also going to go into some RST community resources. So let's get started. So quick introduction, my name is Katrina Fuller. I'm from the Rosebud Sioux Tribe. I have a BA in Behavioral Neuroscience Anthropology, and currently I'm the Health Initiative Director for Sicangu Community Development Corporation. In the picture is my daughter, Ramona Rose, and right now my son is due here at the end of October. So today was kind of a hard pregnancy day. I think a lot of women know towards the end, your pelvis starts really hurting. So that was my day. My pelvis was really hurting. About Sicangu CDC, well, we have 4 initiatives: the Health Initiative, Food Sovereignty, Education, and Housing Initiative. If you want to know more about us, go to our website, sicanguscdc.org. Follow us on Facebook. I especially recommend following us on Facebook because that's where we post drawing signups. If we do random drawings, we post our events, our farmers market, pictures and schedules, and our mobile farmers market as well. So there's a lot going on our Facebook. I just suggest checking it out, following. And if you don't have Facebook, then I don't know how you're watching this class right now. No, but yeah, just follow us on Facebook. We're part of a Three Sisters partnership with Tatanka Fund, CDFI, and Redco. So it's Sicangu CDC, Tatanka Funds, and Redco, Three Sisters. Yeah. So how can we be health advocates during a pandemic? Well, let's remember first, in the last class, we talked about our values. We talked about how we believe in connectedness, and we talked about our knowledge and experiences. So when we act as health advocates, we should remember all 3 of those and remember how this pandemic can affect us on multiple levels, the same levels we talked about in the last class, where physical, mental, emotional, spiritual health, environmental. Today we're just going to talk about some basics in health advocacy. So one of the first things we need to learn as health advocates is doing research. We have a question, we have a series of questions here, and part of being a good health advocate means that we need to be able to find the answers to these questions. So our first question is, what is COVID-19? We're going to do some research right now. Let's pull up Google. Excuse me, computer. There we go. All right, so ignore those 2. So let me see. What is COVID-19? All right, first thing that pops up is the CDC. And let's click into the CDC. Oh, first thing, basics. What is the novel coronavirus? It is a new coronavirus that has not been previously identified. It causes COVID-19, coronavirus disease 2019, and is not the same as the other coronaviruses commonly circulated that cause mild illness. So it's a new coronavirus. That's what this is saying. It's a brand new virus. We know nothing about it, which is scary. It's scary, but we've been through this before. As Lakota, we've been through viruses before, and we've survived. So I believe we can survive. It's just we need to be health advocates and help everyone. So spread. How does it spread? Mainly from person to person through respiratory droplets. So that's the main thing, is that this virus travels in droplets. So when you cough or sneeze, you release droplets, or even talk. Wow. So there's a lot of droplets coming out of our mouths and our nose, and we're just, I mean, we are 75% water, aren't we? So we're just oozing droplets. And they can land in the mouths or noses of people who are nearby or possibly inhaled into the lungs. Spread is more likely when people are in close contact with one another, but within 6 feet. Okay, so we know coronavirus is a new virus. We know it spreads through droplets from our mouths and our nose. Oh, what is community spread? I heard that word a lot. Community spread means people have been affected with the virus in an area, including some who are not sure how or where they became infected. Oh, that's scary. So community spread just means we don't know. We don't know how they got infected. Maybe they didn't travel anywhere and they came in contact with someone who maybe was asymptomatic, not showing symptoms. Who knows? That's crazy. So what else do they have on this page? How can I protect myself? How to protect yourself and others. There we go. Knowing how it spreads. So we know it spreads through droplets and in close contact. And if we're sick or not, we still sneeze. We still cough once in a while. Especially kids. Kids just lick their hand and touch everything. So wash your hands often is recommended. Avoid close contact. Cover your mouth and nose with a mask when around others. We've heard all this before. Cover coughs and sneezes. Throw used tissues in the trash. I don't know who would be keeping their used tissues. Clean and disinfect. Okay, well that's good. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. So it seems like very high touch areas, keep it disinfected. So if anyone comes in your home, wash that doorknob, keep them at your door. Monitor your health daily. Oh, that's important. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medications. That could lower your temperature like acetaminophen, so like Tylenol. Oh, some medications can change your temperature, so just be aware of that. And if you are on any medications, I suggest you look up how it affects your temperature so that you can maintain your health and track any symptoms. All right, so we did some of that. All right, so are there treatments? Let's see. Are there any treatments for COVID-19? Treatments for COVID-19. There is no specific antiviral treatment recommended for COVID-19. Again, this is a virus. There's no treatment for the flu either. We just have a vaccine for it. It's a virus. And that's from the CDC. So the only recommendations they have on treatment is around supportive care to relieve symptoms. So that includes self-care, staying at home, getting bed rest, wearing a mask, quarantining. We have a little line about quarantining in your home. Medical treatments. So it seems for medical treatments, they treat breathing, pain or pressure, inability to wake or stay awake, bluish lips or face. So these are all severe signs and symptoms of COVID, it looks like. So we have another one from Harvard Health. Harvard is a good trusted resource. I believe they have like a Native American side to their institution. All right, so we know there are no treatments currently, and we read a little bit about how to prevent contraction and spread. And treatment after contraction is just simply quarantining, staying home, and treating your symptoms. Like any other virus, we're just always treating our symptoms. Even with the cold, there's no cure for the cold. We're just treating our symptoms. All right, so let's move on to the next slide. We're gonna go, I did a little bit of research before this, obviously, and we're gonna go into who is affected and how. So why are we so vulnerable? This chart right here is from the CDC website. It is related to hospitalizations to underlying medical conditions. So if you look right here, you are at an increased level of hospitalization if you have asthma, hypertension, obesity, diabetes, chronic kidney disease is 4 times more likely to hospitalize if you contract COVID-19. Wow. Severe obesity, so we have CHEPA and then really CHEPA, 4.5 times more likely. Well, that really changes, 1.5 times more when it comes to comparing different levels of obesity. And then if you have more than one underlying medical condition, it looks like if you have 2 conditions, you're 4.5 times more likely, or 3 conditions, you're 5 times more likely. Wow, and those conditions include asthma, obesity, diabetes, kidney disease, coronary artery disease, history of stroke, and COPD. So it looks like some of those are some blood-related, heart-related illnesses, diseases. I had hypertension in my first pregnancy. So for all the pregnant women out there, or if you know someone who's pregnant, make sure they stay home and stay safe. You have to watch out, not only for them, but for baby. Yeah, hypertension is related to preeclampsia, so you really have to watch out for that. All right, so this comes from the RC Community Health profile for, I believe, 2017. And the 5 top diseases that we are currently dying from in Todd County is, number 1 is heart disease. And we can see down here, coronary artery disease is part of the underlying conditions. Cancer, but cancer affects your immune system. It might not be on here, but it definitely affects your immune system, especially if you're going through chemo. So anything that affects your immune system, you're more likely to get sick in general, which is not good when it comes to a pandemic. So number 3 is accidents. Number 4 is diabetes on the list. Chronic liver disease and cirrhosis. So that's kind of related to kidney disease. Okay, so next slide. Real quickly, this is hospitalization and death by age. It's comparing, all these age groups are compared to 18 to 29-year-olds. So it seems like 18, 29-year-olds maybe are the I don't know, the standard, the healthy standard. I'm 26, so I don't know if anyone should be comparing to me here now. So it looks like, but we already knew this, children are at a lower risk of hospitalization and of death. They're called the carriers. That's what children are usually called. Under 17, the carriers. But that doesn't mean they're not children that probably have underlying conditions like this that are at an increased risk of hospitalizations and death when contracting COVID. So, so keep your children at home so they don't affect any other vulnerable children. And if we look over here, 30 and up, hospitalizations just increase. The death rate, it looks like, just jumps 4 times higher, 10 times higher, 30 times higher if you're 50 to 64 years old, 90 times higher if you're 65 to 74 years old. Wow. 200, 630. Wow. Our elders are definitely vulnerable. And much of our Lakota language is held by those 50 and older. A lot of our cultural knowledge is held by those 50 and older. So that is terrible. Okay. Keep your elders safe. So when comparing to the Rosebud Sioux tribe, about 35% of our population are over the age of 35. That's a large portion of our population. It's about 1/3 of our population. And so, yeah, if you're part of this group, plus those with underlying conditions, you're just at a higher rate of hospitalization and of a higher risk of death. So stay home, social distance, protect your family, advocate for your family. And let's go to the next one. We have, this is the hospitalization cases, hospitalization, death by race and ethnicity. So this is all compared to white non-Hispanic persons. So it's just comparing us minorities to some white people. And it looks like for Native Americans, we are at a 2.8 times higher risk of cases. There's 2.8 times higher number of cases. The hospitalization rate is 5.3 times higher, and our risk of death is 1.4 times higher when compared to the general whiter population. I think that's pretty interesting that we are comparatively very high in contracting COVID and being hospitalized for it, but when it comes to the death rate, it looks like African Americans are 2.1 times higher, which, wow, that's a big difference between our 1.4, but still, we need to keep each other safe. So we keep skipping this part, and I'm just going to go over it real quick. Factors that increase community spread and individual risk. So we saw this when we did our research. We saw that we should avoid crowded situations, that there's a 6-foot social distancing rule. When it comes to your home and enclosed spaces, you should, well, I mean, not your home, but in enclosed spaces like the grocery store, very public spaces, you should wear a face mask. And in your home, you should, if you contract COVID, you should quarantine. And then plus the duration of exposure. So that just means if you go in the store, go in quick and get out. Yeah, all right. So we did our research, and now we're going to talk a little bit about how we're going to advocate for each other. So we all should prevent contraction spread by social distancing, wearing face masks, washing hands, avoiding large gatherings, track and maintain our family's health through temperature checks, through symptoms, daily list of contacts in case you ever contract COVID, or if someone else contracts COVID that's within your circle of individuals. Keep a daily list, at least, for your kids especially. Getting tested is important. And then part of our Lakota values is respect and compassion. And that's what we should have during this pandemic, is we should all be respectful and compassionate, because at some point we will all need help. And then self-care. Self-care is very important. It's hard to be an advocate. And it's hard to live through a pandemic. So we all need to help each other, take care of each other. So we're going to talk about advocacy on 3 different levels, and I'm only going to pull one example out of each for the sake of time, but I'm sure you can, if you have any questions or input on any of these areas, then just comment on the Facebook post, or Facebook message me, or email me. My information will be at the end of this class. So number 1, promote access and resolve barriers to services that improve and maintain holistic health. So we can do this. So we can promote access and resolve barriers by simply social distancing and promoting social distancing. And social distancing to me is all about self-discipline. Can you stay home? Can you limit your trips to the store? Can you maintain your household during this pandemic so that you can have the least risk of contracting COVID, you and your family, or those that you're trying to help. So self-discipline is huge. And as a Lakota, we were always taught discipline. We were always taught self-discipline. In a lot of our ceremonies, it is about self-discipline. To be able to go on the hill for 4 days is self-discipline. That's hamblecha. To be able to go to sweat and last for 4 or 5 rounds, that's a lot of self-discipline. To be able to do anything that we need to do to prepare for ceremonies, to go to Sundance, to bead, to sew, to anything requires a lot of self-discipline, and we know how to do that. Around this is also parenting. If I see a lot of kids running around still, and that requires a lot of parenting skills to be able to keep your kid at home during a pandemic. It requires a lot of parents to step up their skills and be more strict. So if you need help with parenting, or if you know anyone who needs some help, do some research how to keep our kids at home. It just might be some discipline. It might just be, that might just be it. Just might be some discipline. And I know how wild we all get, but we have to be not only disciplined with ourselves, but with our family, and with to set those boundaries. And yeah. So instead of staying home, you can always go out and walk around outside. Nature walks are really good, isolated, not walking around the community or anything, but nature walks are always good. Just, walks that keep you social distancing are good. Gardening is always good. It's also a good social emotional health tool. It can calm your mind, relieve stress. So right now is a great time to connect with nature. Part of social distancing is having a home quarantine plan, your own home social distancing plan, literally. If you live in a small household, or if you live in a large household in a small home, I know that's going to be difficult. So because it's difficult, you should take some time to think about it. If one of your kids got sick, if one of your elders got sick, if you got sick, how would you be able to quarantine yourself in your home? Oops. You don't have to write it out or anything like that. Just think about it, though. Think about it. We shall put some thought into it. How would we self-quarantine in our home? I know if you do test positive for COVID and you have to quarantine and you're forced to, you can't go to the grocery store. You can't take your kids to a doctor's appointment. You can't do anything. You have to stay home. So do you have that point of contact in your family that can do that for you if that time ever comes? Or can you be that point of contact for someone else's family if that time comes? And just be prepared for that. And then there's the tribal quarantine. I'm not quite sure how far they are with this plan, but again, we can always reach out to our council members and say, hey, look, we have this many people in our household, and now we have to quarantine. So what do we do? We have tribal resources, and we have our health administration that we can ask questions to when it comes to quarantining or any type of other level of social distancing. So let's go to number 2, navigating local resources, local healthcare systems, i.e. IHS, Mission Medical, Winter, Valentine Hospital, Tribal Health Department, etc. So let me see, which one should we go into? Let's go into, I guess they're all pretty much related to each other. Let's just go into research and questions and research. It's important when you're navigating that you can do research, that you can go online, or you can call people and ask questions. Trusted sources. I mean, don't just call your relative and say, what's the tribe doing? Well, you could. Trusted resources. If they say, I don't know, or if they make something up, then they may not be a trusted resource. But so asking questions is really important when it comes to anything about your health, especially during a pandemic. No one knows what to do, how to react, or even, I guess, other levels of things. But asking questions is extremely important right now because, well, first of all, there's testing. And being able to ask questions and do research on testing is extremely important. You want to know what that test means. You want to know what it's looking for. You need to know how to interpret your own test results. Tests aren't black and white. It's a new virus. These are new tests. They're not going to be 100%, and no one is going to tell you that. So I'm telling you that these tests are not going to be 100%. There's already, if you saw on the CDC website, there's already an issue with being tested negative and then being tested positive later on, or very soon. Even if you had COVID before, you can still test positive. That's one thing they're finding. So if you do your research around test results, you'll find a lot, and it's very confusing, but these are things we need to know. We need to know, everything about our health, especially when it's something so new. And then, asking questions with our healthcare providers themselves too. If we have underlying medical conditions and we don't want to come to the hospital, how do we treat and maintain our health? So asking those questions and asking questions of our tribe and keeping up to date on the COVID-19 information that they release. And then finally, let's go to number 3, understanding and advocating for ourselves in our government-to-government relationship. So one big thing right now is the census. We got the CARES Act funding, right? So why does it keep doing that? So right now would be a definite, there's a definite need for everyone to fill out their census. If more CARES Act funding comes through next year, who knows? They might look at our 2020 census, which does play a part in the funding. So we need to count our population. We need to know who's all here, how many masks we need, how many vaccines we'll need when the time comes, everything like that. So fill out your 2020 census. It's not hard. And now you have the research skills to go and look up, how do I fill out my 2020 census? And it should take you to a very easy website. Next thing is voting. We have tribal elections and U.S. elections, state elections coming up. Treaties and sovereignty. It's about improving our health our way. We have our own trusted resources. We've been through a new virus before. It might have been, 100 years ago with the smallpox blankets, but we still have that ability to care for ourselves and to survive. And the partnerships that we can form and taking care of ourselves our way. We're not following South Dakota State, as you can tell. We're doing a lot more when it comes to social distancing and enforcing mask wearing and things like that, which I think is great. And that's all part of being sovereign. So let's support that. So real quick, RST community resources. For more information on the pandemic, you have the ability to do research, but as a trusted resource, the CDC is always there. For the most up-to-date information on RST's response to COVID-19 and announcements, we can go to the RST website. They have a specific coronavirus information page. For the tribe's COVID-19 response to the RST CARES office, they have a Facebook page for that. And to view council meetings, you can go to the RST YouTube page, and there's a link on here for that too. If you need to get a hold of your tribal council members, who are essentially our governmental health advocates, then you can always go to the tribe's government page, and it lists their phone numbers now, which I think is pretty great. So you can always text them or call them, and they're probably very busy, but there are our community health advocates, our governmental level community health advocates. And then we have the SF suicide hotline. We have the Takala Inagio suicide prevention hotline. And if you think you or someone you know has COVID, then you can always speak with the nurse, or you can talk to them about any of your underlying conditions and how COVID might affect it. Anything like that, you can always call the nurse, and now they can answer your questions over the phone, which I think is pretty awesome. All right, everyone. Kilama Yaye. My name is Katrina Fuller. I'm the Sicangu CDC Health Initiative Director. My email is posted on here, katrina.fuller@sichangucorp.com. You can always email me or Facebook message me. I'm pretty responsive. Yeah, and if you have any questions or if you want to see something specific, just let me know, and I'll post the slides too on our website. So today we covered how we can be health advocates during this pandemic. We talked about learning to do research. Research skills are very important. You have questions, you got to learn to find them. Why is the RST a vulnerable population? We learned about that through age, through race, through underlying conditions, and then how we can advocate locally in 3 areas. And I gave an example in each of those areas, but there's more listed, and if you have anything to add, just comment on the Facebook post or else message me, and I'll leave it in the comments for you. I don't know. And then we went through some community resources, local and also CDC level community resources. So again, thank you, and yeah, thank you, and have a good day. Can't wait for the next class.